Let's talk about the anatomy of MRI knee today. So let's scroll our images. I have put a digital PDFs view, and here you can see that I am opening the MRI knee images for you. You can see the my arrowhead. This is femur, and this is tibia. Okay, this is femur, this is tibia, and the third bone that forms the knee joint is the fibula. You can see the fibula, the tibia, and the femur. Okay, so first of all, we will look for the ACL and PCL, anterior cruciate ligament and posterior cruciate ligament. So this band, I will show the ACL is like a band. So the band that is extending from the articular surface of the tibia to the articular surface of the femur is this ACL, anterior cruciate ligament, as shown by this arrowhead. And along the ACL we have another cruciate ligament. This is posterior cruciate ligament, that is blackish or hypo intense. You can see that I will trace the posterior cruciate ligament in this way. This is the whole attachment of posterior cruciate ligament. Okay, and this is the anterior cruciate ligament that is holding our knee joint. And this is, and now we will look at the meniscus. There are two meniscus of the knee, a medial meniscus and the lateral meniscus. Okay, each meniscus has two horns, anterior horn and the posterior horns. So first of all, we will go to the bones and we will locate the meniscus. This is fibula, and it is present on the outer part of the leg or our knee joint. So the meniscus above this will be lateral meniscus. Okay, this is the posterior horn of the lateral meniscus, and this is the anterior horn of the lateral meniscus. You can see a hyperintensity inside the meniscus horns, that is the grade 1 tear. Okay, now we will look at the other meniscus, that is the medial meniscus. Medial meniscus also has two horns, same. This is the posterior and this is the anterior. You can see that there is no hyperintensity inside their horn, so this meniscus is normal. Okay, and you can see this is the fat set sequence. So Hoofa's fat pad will be appear as black as there. I will show that you in the other T2 sequence. This is a joint of fusion. This is also joint fusion extending to the prepatellar surface to the suprapatellar area region. Mild joint of fusion, we can say that. Okay. Here you can see that I have opened the T2 sequence for you. In the T2 sequence we know that the fat is fat, while in the fat set sequence we know that fat is black. So here you can see the Hoofa's fat pad, and the fat pad looks intact. We should look at the appearance and the contour of the fat pads in our MRI sequences. And joint of fusion is still there, cruciate ligaments are still there. So that's a bit overlay of our MRI knee and anatomy. We have a grossly look at the main structures that we look daily.